To feel the prostate, especially when it's enlarged, we just need to put a finger into the anus or rectum, and we can actually feel in front of it the prostate, especially when it's enlarged. And if it is cancerous, most of the time it is very hard.
It's not surprising why many men are reluctant to get their prostate checked. As you just heard, the doctor will have to stick his finger up your ass. But the reality is, once the signs and symptoms become more obvious, it may be too late for better recovery or even survival. And if it comes to having to remove your prostate, your sexual function may be severely affected. If you're not really thinking about taking care of your prostate now, then think again. And in this podcast, we will help you understand what is a prostate, where the prostate is, its function. We'll talk about enlarged prostate, prostate cancer, and how to take care of your prostate. All this with my special guest today. He graduated from University Kebangsaan, Malaysia in year 2000 and followed that with his Masters of Surgery in 2008. He then went on to Glasgow, Scotland to obtain his subspecialization in urology, completing in 2012. Not content with that, he further developed an interest in sexual medicine, obtaining a fellowship from the European Committee of Sexual Medicine in 2012 after being trained under experts in Oxford and Milan. He's a consultant urologist at Oriental Malacca Straits Medical Center, ex-professor of surgery and urology at the National University of Malaysia. He has published more than 130 journal articles and authored 5 books on men's health. If you're ready, it's time to man up with Professor Dr. Christopher Ho Chee Kong. Hi, Prof. Thank you for being on Man Up Malaysia.
Hello, Kevin. Yeah, thanks for inviting me to be on your show.
Now, Prof, I will admit, I hear a lot about prostate cancer and all, but before Googling about it, I didn't know what it was, where it is in our body, and also what does the prostate do? So maybe for other men out there who are just like me, can you help us understand what is a prostate?
Okay, yes, Kevin. Actually, it's not only you. A lot of men and ladies as well. They do not know what prostate is. In fact, some ladies come to see me and they ask me to check their prostate as well. Which to them is prostate is an organ which is only seen in men. So prostate, where is it situated? It is just below the bladder. It's just below the bladder, and when the urine passes out from the bladder, it actually needs to go through the prostate. Then it goes to the penis, and then it comes out. All right. So the passageway from the bladder, as it goes through the prostate and through the penis, that passageway is called the urethra. So yes, if there's any problem with the prostate, it may affect your urination as well. The size of the prostate is about 20 gram in a normal young man. In the West, they usually say it's the size of a walnut. So it's about 20 grams. It's about 3 to 4 centimeters in size. The function of the prostate, yes, is seen only in men. In terms of function, it produces this prostatic fluid, which is actually alkaline, and it mixes with the semen, the sperm, to help with the survival of the sperm when it enters the vagina of a lady, which is usually acidic. So it is a little bit acidic to sort of like neutralize and to help the sperm to survive a bit longer in order to fertilize the egg or the ovum in the lady's uterus.
All right, so very much to do with our reproductive system as well. Now, before we talk about prostate cancer, maybe we can talk about enlarged prostate. Firstly, how does the prostate get enlarged?
Okay. Enlarged prostate can happen in many ways. One is when there's infection, inflammation, then it gets enlarged. Another one is due to aging. So with increasing age, our prostate will continue to grow. And the reason it grows is because of this male hormone that we have, testosterone, which will stimulate it to continue to grow. So as long as we have the testes, we are producing testosterone, the prostate in the body will continue to grow. For those who have their testes removed, then of course, then the prostate may shrink and it may not grow. So when the prostate is enlarged, what happens is that, as I said, the prostate is an organ which transmits urine through it. So there's a hole in the middle of the prostate where urine passes through. So when the prostate is big and enlarged, there's a capsule, sort of a pseudo capsule outside of the prostate, which actually, when it grows large, for it to expand outwards is a bit confined and a bit more difficult. So it may actually grow inwards, and it may actually constrict the hole where the urine passes through. So when that happens, then urination may be difficult, and the symptoms or the complaints that people will have would be, number one would be they call it hesitancy. That means they take a long time before the urine actually comes out. They have to wait for a long time. They may need to strain to increase the pressure in the bladder, to increase the pressure to enable the urine to pass out. And other symptoms or other things which they may have problems with would be the flow will be very slow. And at the end, because the pressure is very low, at the end, when there's not much of pressure, the urine may actually drip, and they call it terminal dribbling. So it may drip and may wet the pants, may wet the shoes. So it doesn't shoot out like a normal man to the urinal.
So, our urination can tell us a lot about our prostate. Is it painful to have an enlarged prostate as we go about our daily activities?
Normal daily activities, no, it shouldn't cause any pain unless you can't. It's so bad that you can't pass out urine at all. So there's a lot of retained urine inside. Then you may get the discomfort because your bladder is full.
So, can we treat an enlarged prostate, and how do we prevent it from getting enlarged?
Oh, of course, it is treatable. There are medications which can help, and also lifestyle modifications to actually help with the urination. So, in terms of how to prevent or not, without medications, what is advised is believed that this enlargement of prostate is due to Western diet. So, in order to reduce this risk, then normally we advocate taking more fruits and vegetables, taking more tomato, and reducing all the fat and high protein in your diet. Medications, yeah, there are a lot of medications which can be tried. Medications, one is to help to relax the muscle in the prostate, and by relaxing the muscle in the prostate, we hope that the hole inside for the urine to pass through will be more distendable, and therefore the hole will become a bit more bigger, and the urine will be able to pass through. Another type of medication is to shrink the prostate itself. Hopefully, with the size being decreased, the urination will also improve with it.
You know, Prof, I recently did a show about TCM and infertility. Now, for those of you watching this or listening to this episode, if you have not watched that episode, TCM and male infertility, you can watch it on our YouTube channel at Man Up Malaysia. But Prof, to treat an enlarged prostate, would you say TCM is helpful?
Okay, so TCM in terms of traditional complementary medicine, what has been tried before for many years is things like the saw palmetto, lycopene, but the evidence is still not that great. The evidence is still not strong enough to actually recommend it to be the only medication that you should take. There's no harm in taking it. I've got patients who try, I've got people who try, men who try it, and they say it works. But as I said, there are not much studies done on it, probably because it's not really commercial, so not many people actually embark doing it. There are a few studies, very small studies, but the outcome is actually quite controversial. So for those who actually come to see me, they say when they want to try traditional medication, I say no harm, because I think there's hardly any side effects. You can try. And if it does not work, most of the time it doesn't really work, then you actually need to take the proper medicine, which has been shown in studies to actually be effective. And it's been done on thousands of hundreds of thousands of people, of men, and is shown to be working.
All right, that's good to know. Would we need to undergo surgery for an enlarged prostate?
Normally, we don't go straight into surgery. Yeah, we'll advise to try the lifestyle modification with the diet and so on. And if it doesn't work, then we start medications. And I would say that the medications nowadays are actually very, very effective. 80-90% of the time, it actually works, and you don't have to go for surgery.
All right, Prof, let's move along to the big C. Now, does an enlarged prostate lead to prostate cancer?
Okay, so the prostate itself, when it continues to grow large, it does not necessarily mean that it will become cancer. Even the prostate which is not large can also be cancerous. So in enlarged prostate, most of the time we need to actually make sure that the enlargement is not due to cancer. So we have to do a few tests to make sure it's not cancer, and if it's confirmed it is not cancer, it's just a normal enlargement due to aging, then you don't have to worry. Just need to take medications, and if it becomes very bad, medications one does not work, then of course the next option would be surgery. So not necessarily all enlarged prostates are cancers, and not all cancers are enlarged prostates. There
Mm.
are cancers in prostates which are actually small prostates.
How do we check if the prostate is cancerous?
Okay, when you go and see a doctor, the first thing that he will do is he will ask regarding your risk for cancers. So the risk for cancers is that if you have a family history of cancer, that means a first degree relative who has cancer, in other words, either your father, his brothers, or your siblings, all right, your grandfather. So if any of these relative of yours has cancer, then your risk of cancer increases multiple fold. All right. So that's one risk factor. Another risk factor would be age. So if you're in your 70s, 80s, of course, the risk of cancer is much higher. So that is what the doctor usually assess first to see your risk for cancer. The next thing he will do is then he will examine you. And unfortunately, the only way we can feel your prostate is actually to to push in a finger into the anus. All right, because the prostate is, as I say, it's under the bladder, but it's in front of the rectum. It's in front of the anus, where your feces or shit comes out. So to feel the prostate, especially when it's enlarged, we just need to put a finger into the anus or rectum, and we can actually feel in front of it the prostate, especially when it's enlarged. And if it is cancerous, most of the time it is very hard. It's hard like wood, but if it's very hard, and the surface is irregular, we can feel nodules, we call it, irregular surface, then very, very suspicious of cancer. Then the third thing that we'll do is actually blood test, and the blood test that we'll do is what's known as PSA, or prostate specific antigen. So this blood test is specific for the prostate, and when it is high, at the moment we take it above 4, the level of 4 nanogram per mil, then it is very suspicious of cancer.
Now, about the PSA test, when should men get a PSA test done?
It's actually advised above 50. So those who are much younger, not necessarily to actually go for this PSA test. So once you touch the age of 50 and you're above it, it's advisable to go for PSA test, if possible, every year when you go for your medical checkup. But if you have a high risk factor, that means you have a first degree relative who has prostate cancer, then you're actually advised to get it tested much earlier. Your blood test, the PSA, should be done from the age of 40.
So I find it puzzling when I read that prostate cancer is not life-threatening. Can you clarify that, or shall I put it this way? Can prostate cancer kill you?
Of course, any cancers can actually kill, but prostate cancer is one of the better cancers to have. Why? Is because it's actually most of the time it's actually slow growing and not aggressive. But there are prostate cancers, unfortunately, those who actually get it, the high grade ones, they are aggressive and it can actually progress very, very quickly. But by and large, the majority of prostate cancers are actually very slow growing. It's one of the better cancers to actually have because of its nature of actually being very slow and non-aggressive.
So in that case, can we say that most men won't die from prostate cancer? What is the survival rate?
Okay, so for prostate cancers, as I said, it is a sort of like a good cancer to have if you want to choose any cancer. The reason is again because it's slow growing. So what we advocate is actually to try to diagnose or to discover or to get it treated at an early stage. If it is treated at an early stage, and what we mean by early stage is that it has not actually progressed and gone outside of the prostate. So in medical terms, we call it metastasis. So if it is localized, it's a localized cancer inside the prostate only, it has not gone outside, then treatment is actually very good. 5-year survival rate can reach almost 100%. So it's almost curable if it's an early stage where it's not gone outside of the prostate. But once it's actually gone outside the prostate, then the survival rate actually drops down a lot. So the 5-year survival rate is only about it drops to about 30% if it's actually gone outside the prostate.
Hmm.
So the key word here is to discover the cancer early and get it treated early, as you can actually be cured.
Okay, so if we want to detect it early, what are the signs we should look out for?
Unfortunately, for the early stage, most of the time it is asymptomatic. There are hardly any signs and symptoms. It is most of the time discovered when they go for screening, when they go for the blood test, which is actually the PSA. When you have signs and symptoms, that is when it's already actually quite late. So those who come with signs and symptoms, most of the time when we diagnose and we further investigate, we find out that this cancer has already spread out. So the signs and symptoms, if you have, would be bleeding, blood in the urine. All right. So when there's bleeding in the urine, that means the cancer is already quite extensive. It's quite extensive. Most probably has already gone outside, and is causing the tissue of the prostate to be very friable and bleeds easily, because there's a lot of vascularity, a lot of blood vessels, which is actually feeding the cancer cells. So it bleeds very easily. So when that happens, usually it's actually quite an advanced stage. That means it's not an early stage cancer. Other signs and symptoms of prostate cancer would be pain. Okay, pain again when the size has grown so much, or when the cancer has invaded at nearby structures. So it can invade the nerves and so on. It can even invade the bladder, which is nearby, and then it can cause obstruction. So when it gets obstructed, then you can't pee, your urination will have problem. You can't empty your bladder, and in the bad stage, you can't pee at all. Urine just totally cannot come out. So the bladder gets fully distended, then you need to do something, probably put a tube in to relieve the urine out. And another sign and symptoms would be bone pain. All right, on that is already very bad. Bone pain means it's already spread to the bone, so it's already stage 4. It's already the last stage. Cancers as well, you may have loss of appetite and loss of weight, so you don't have any appetite to eat, and then you grow very thin. A medical term we call it cachexia. You become very very thin, and just bones only that you can be seen.
Wow, so when we arrive at those signs, the cancer is already quite severe. That's why over and over again, especially in the month of November, we hear a lot of campaigns and initiatives encouraging men to go and get their prostate checked. And at Men Up Malaysia, for those of you watching, if you want to make a health pledge to go and get checked, stay accountable to that pledge, then just head over to our website for more details at menupmalaysia.com. Now, Prof, before we talk about treatments for prostate cancer, are there different types of prostate cancer?
Okay, prostate cancer, yes, there are many different types, but the most common, 90%, is actually what is known as adenocarcinoma. So, adenocarcinoma is a cancer which involves the glands inside the prostate. There are other variants which are very very rare, and if you get the other variants, then unfortunately that would be very aggressive, and your prognosis would not be very good. So 90% of the chance of the time is actually adenocarcinoma. We do get things like squamous carcinoma and so on, anaplastic carcinoma, and hopefully you don't get it, because it's a very bad news for you. Then the next thing we look for prostate cancer is actually to look at the grade. The grading of the cancer, whether it's high grade or low grade. Low grade means is less aggressive, whereas high grade is very aggressive. To diagnose the prostate cancer, as I said earlier on, we look at the risk factor, we do an examination, and also we do the blood test. So those are actually investigations to help us to determine whether you're at high risk of cancer. And if it is high risk, then the only way to confirm whether you have cancer or not is actually to do a biopsy. So a prostate biopsy involves taking a few tissues from the prostate. So most of the time it's at least 10 tissues to be sent to the lab, where the doctor will actually look through the microscope to confirm that the tissues are actually made up of cancer cells and not just normal cells. So how do we do a biopsy? A lot of men are actually very scared getting the biopsy done. So again, it involves putting a probe, an ultrasound probe, into the anus. All right. So there may be a little bit of discomfort, but it's not very very painful. There's more anxiety in men most of the time when I do, that they are so anxious and so worried that it causes pain, that the anxiety itself causes them so much a problem. So it's a bit of discomfort only. It's not really painful. You can imagine your passing motion also. Your feces is sometimes hard. It's actually much larger than the probe itself. So the probe goes in. Then what we'll do is we'll give some injection around the prostate to numb the area. Then once it's numb, we'll use needles. The needle size is long, but it's actually, in terms of diameter, in terms of the size of the needle, it's almost the same as what we use to take blood from you. So we'll use those needles to take few tissues from the prostate, about 10 to 12. then we send to the lab. And from there, then we get a confirmation. After it's confirmed, then the next stage we actually need to do is to see, as I said, whether it's confined to the prostate or whether it's gone outside. And the way to do it would be to do scans. And the scan that is normally done is the MRI scan to look at the prostate and see whether the cancer is just inside or whether it's gone outside the prostate. And another scan that can be done is a bone scan, because the most common part that the cancer goes to outside the prostate is actually the bones. So we do a bone scan. And nowadays there are newer scans, we call it a PET scan, PSMA scans, which are more expensive, but which are more sensitive and can actually detect the cancer cells, even if it's very minimal, very minute, throughout the whole body.
Your Prof, it sounds quite scary, all these procedures. What would you say about men who are afraid of these invasive procedures? What would you tell them?
Afraid actually, but it's advisable, as I said, because if it is detected in an early stage, you can be safe, you can be cured, and you can have you can continue your life like usual, rather than get it discovered late when nothing much can be done. I mean, things can be done, but it's just to control the cancer and not cure.
In terms of treatments, there's surgery and radiotherapy. But there's quite a huge debate on surgery and radiotherapy. What's your take on it? What's your opinion?
In terms of treatment, cancer, radiotherapy as well as surgery. So treatment for, I need to go to, first of all, the different types of treatment for cancer. So the treatment for cancer can be simplified by looking at the stage of the cancer. So if it is confined into the prostate only, it has not spread outside the prostate, then the treatment is to either radiotherapy or operation, or you don't do anything, which is actually not advisable. So it's either operation or radiotherapy. But once it's gone outside of the prostate, if it is only a little bit only outside of the prostate, then you will need radiotherapy. But if it has spread to other organs, to the bones and so on, then you can imagine you just take out the prostate, it's no use also, because you're just taking out the cancer in the prostate, but the cancer has already gone elsewhere. So removing the prostate will not do much, because the other cancers are already all over your body. So you need something more systemic, something which can actually go all over your body to control the cancer cells. And for prostate cancer, the first thing that we usually give is this anti-androgen therapy. Is actually anti-hormonal. So it reduces the reduces the testosterone hormone, and therefore reducing the stimulation of the prostate cancer. So this involves injections, these medications to control the hormone, injections, or another way is actually to remove the source of the hormone itself, which is the testis. So you remove the balls, then there's no production of this hormone. We can actually control the cancer as well. So for radiotherapy, what you're asking is the controversy between radiotherapy and surgery is actually a treatment for the localized early stage cancer, which is confined only to the prostate, it's not gone elsewhere. So for this type of cancer, then in terms of radiotherapy and surgery is almost actually equivalent. There is no real direct head-to-head studies between radiotherapy and surgery for the treatment of this localized prostate cancer. What we have is actually comparison. That means they've done studies on radiotherapy, they've done studies on the surgery for cancer, and they compare these two studies, and the outcome has been shown to be almost similar. The only difference are the side effects and also your suitability for undergoing surgery. So surgery is known as radical prostatectomy. We actually remove the whole prostate. So with the hope that by removing the whole prostate, we are removing all the cancer cells. There's no other cancer cells elsewhere. So when we remove the prostate, all the cancers will be removed and you'll be cancer-free. So that's the good thing about surgery. But of course, surgery is a major surgery. There are a lot of risks involved. If you are not healthy, you've got multiple problems, your heart is very weak, you've got a kidney disease and so on, and you can't undertake the long major surgery, then the option for you most of the time we advise would be radiotherapy. So operation is good because you remove all the cancer cells. You can be quite reassured that you don't have any cancer cells inside your body, but it involves a lot of risk, major surgery, bleeding, your sexual life may be also affected, and also there are risks of injuries. Your incontinence, your urination may not be normal because we are removing the prostate, which is actually part of your urination before this. So your body may take a bit of time before you can actually adjust back to normal. Whereas radiotherapy does not involve any surgery. The risk is of course much lower, but the only problem is that you need to keep coming to the hospital every day, most probably for about a month, every day for about a month to get the radiotherapy, which is about 1 to 2 hours sessions. There are new modalities which can actually shorten it, but it is for really small cancers and really non-aggressive cancers. But by and large, is most of the time it will be take about a month of radiotherapy almost every day, where you have to go to the hospital to get it done. And in terms of cost, it's almost equivalent also, because of the radiotherapy, you need to go very frequently to the hospital.
All right, thank you for that explanation. Now, Prof, let's turn our attention to prevention. How should we take care of our prostate?
So to take care of the prostate, number one would be your diet. All right. So cut down on all these oily food, cut down on fat, and cut down on high protein. So all these McDonald's, KFCs will have to go away. Of course, not totally, just to cut it down. Otherwise, I think nobody will want to live. So cut down all this Western diet. Go back to the Asian diet, where we take more vegetables and fruits. All right, all these antioxidants which will actually help. And it's believed that things like tomato, mainly tomato, saw palmetto, all this can actually help with the health of the prostate as well. That's diet. Then other things that can be done is also healthy lifestyle, moderate exercise. It's also been proven. All right, there are studies which actually shows that it does help also with the health of the prostate, and also to maintain your weight, the ideal weight, not to be too obese. All right, be in the ideal BMI range for your height. Your weight should be just suitable for your height, and all this will actually help you with your prostate health.
Prof, just a quick question. Can we damage our prostate physically, like maybe masturbating too much?
Yeah, that's actually a myth, which is a lot of those who masturbate a lot, they have this guilty feeling. Yeah, I do have men come in and say that they have some discomfort at the area of where the prostate is, and they say they confess that they masturbate a lot, almost 2-3 times daily. Of course, if you do that, if you masturbate 2 to 3 times daily too often, then you will actually the act of actually masturbating itself will put a strain on the prostate. All right. So when there's ejaculation, of course, the contents in the prostate will also be ejaculated out, the prostatic fluid, and you will sort of like work out the prostate after a while, and the prostate will also get a little bit tired. You may actually have blood also in your semen if you are too aggressive in your masturbation. But a normal masturbation, like maybe 2 times a week, all right, I don't think it will actually cause much problem to your prostate. In fact, it may be actually be beneficial for you to actually masturbate occasionally, to empty the fluids in the prostate, because too much of accumulation of these fluids may actually cause distension, as well as it may actually cause infection as well.
Prof, before I let you go, what is your advice for men listening to this, especially on getting checked?
By and large, men in Malaysia are still very afraid of going for checkups. But I think it's very important to have your health checked early. As I said, if you detect anything early, you can be treated and you can be healed, you can be cured, you can have a long life. We don't want you coming in when it's already too late. There's nothing much that we can do. Tears will not help much. So for men out there, please ensure that you go for medical checkup frequently, all right, annually, especially from the age of 40. But for prostate, you should have your prostate checked after the age of 50, unless you have a high risk. And the high risk, I mean, is actually you have a first degree relative, uncle, grandfather, father, who has prostate cancer. So for those people who have a family history of cancer, you should have your prostate checked, as well as get the blood test PSA done from the age of 40, and if possible is annually to be done. And we know also from statistics and from what we see in the hospitals, other diseases, not only prostate, cardiovascular, that means heart problems. Men are getting it at a younger and younger age.
Mm.
Not only men, ladies as well, but the age is actually the age of those who get these attacks are getting lower and lower. We are seeing men who are 30s, and there are some even 20s who actually come in with heart attack. And not only that, not only prostate cancers, another common cancer which happens in men is also colon cancer. And again, we are seeing it at a very much younger age. My colleagues who are colorectal cancers, they say they are seeing men who are in their 30s who get colorectal cancers. But fortunately for prostate, it's still a disease of the elderly. So most of the time, the average age of those who got prostate cancers are usually about 60s and above. All right, but you should get your check by the age of 50.
All right, thank you so much, Prof, for taking the time to speak with us about this. I hope this will help educate men and create more awareness and also encourage them to get their prostate checked. Thank you so much.
Okay, Kevin, thanks.
That was Professor Dr. Christopher Ho Chee Kong, consultant urologist and professor of surgery, telling us all about the prostate and prostate cancer. Here's another reminder. We like to encourage all men above 40 or 50 years old to go and get their prostate check. Don't forget what Prof said that, by the time you see the signs and symptoms, it may be too late. So, you can make a help pledge at manupmalaysia.com. Be accountable to your pledge and go and get checked. It's time to man up and get it done. More details once again at manupmalaysia.com. Right now, it'll mean so much to us if you could like this video, share this video with your family and friends, and also don't forget to subscribe to our channel for more mental health related topics. I'm Kevin Francis for Man Up Malaysia, and I'll see you in the next episode.